we're going to do. We're going to look at your spine, okay? And we're going to first start talking about the normal areas in the spine, okay? Now, let's go ahead and make this, okay. So, this is what's called the sagittal or parasagittal MRI. This is really a one-dimensional view, okay? It's a one-dimensional view. And we're going to focus on this first, and then we're going to correlate it with this, okay? So this is a one-dimensional view where your abdomen is over here. This is anterior, so this would be where the front section is. And this is the back, your spine over here, okay? This is where your tailbone begins, okay? We have 5 bones in our spine in the low back. It's called lumbar, and they're labeled lumbar 1, lumbar 2, 3, 4, 5, and then we hit what's called S1, which stands for sacrum, the beginning of our tailbone. Sacrum eventually terminates in what's called the coccyx, okay? So, when we look at the spine from the side view here, we see that your spinal cord stops right here at L1-2. Okay? This is where it stops. Meaning, after this termination of the spinal cord, which is normal to stop at this area, we have what's called the cauda equina, which in Latin means horse's tail, which are all the nerves that then go down into the legs, okay, and form the femoral nerve, the sciatic nerve, and a number of other peripheral nerves. But the spinal cord stops here. Okay, so there's no spinal cord down here where your problem is. The problem is the impingement on the nerves from the stenosis. Make sense?
Yep.
Okay. So, now, we're going to be looking at, we're going to use this as our control level. Now, the reason we're going to use this as our control level and not a picture of a normal MRI is because everyone's control is different, okay? All I care about is what your control level looks like, all right? Or an area where there's no nerve impingement, so I can show you that. Well, your control shows scoliosis, right? Because we know you have scoliosis. Now you could see the bone, right, pointing, or the disc pointing in this direction, okay, around 11 o'clock, okay, instead of up and down, which would be 12 o'clock. So, what do we see here? Well, first of all, we're still at the level of the spinal cord. So
where's the spinal cord on the left?
The spinal cord on the left is this gray structure right here, okay?
Okay.
The spinal cord is bathed with this white fluid in the front of and in the back of the spinal cord. That is called cerebrospinal fluid. Cerebrospinal fluid has glucose, protein, and water, and it functions to cushion the spinal cord and the nerves. Every time you go over a speed bump in your car, or you're going jogging, or you're walking briskly, your spinal cord has very small motions back and forth. And that fluid is to protect it, but also supply it with some nutrients, okay? So, that's what that white is, okay? This is a T2 weighted image. What all that means is that water on a T2 weighted image will show up as white, okay? So we're going to use the T12 level here and the L1 level here as your control, meaning this is a very good level for your spine. And then we're going to go over to this on the right side. We're going to explain what the axial image is. This is anterior. So whereas on this one-dimensional view, we have anterior-posterior, here we have front, abdomen, back, posterior, where the back of the spine is. This is the right side. You can see the R. This is the left side. Now, why is that? We would think it would be flipped around. Well, the reason that is because it's an MRI taken looking from the head down towards the toes. Does that make sense? Okay. So, this is the spinal cord. Okay, we're still at the level of the spinal cord, and this is what the spinal cord looks like. You have a very nice, capacious area allowed for the spinal cord at this level because there's no stenosis. And where my pointer is right now, okay, can you see that? Mm-hmm. That's where the nerve exits, okay? That nerve exits through what's called the foramen. This is the foramen right here. Make sense? Mm-hmm. This is the foramen on the other side, okay? This right here is the facet joint. It's a true joint. It allows for motion within the spine, Okay? So that joint is on the left side, it's also on the right side. When we look at the discs, we want to see a healthy disc. Now, I'm going to tell you that your discs are what are called desiccated, so they're a little bit dried out. Now, one of the reasons for that is, as we age, we lose a protein called proteoglycan. Proteoglycan is hydrophilic, it attracts water. Think of the disc as a wet sponge, okay? A healthy normal disc is going to be compressed and then re-expand, compressed and re-expand, okay? Now, just because, remember we talked about on T2 weighted images, water, right? Water is white. Your discs are dark, okay? So that shows us that the discs are somewhat desiccated. Doesn't mean that that area needs surgery. It just means that you have lost that proteoglycan, hydrophilic protein, that attracts water into the disc to maintain that compressibility and expansile ability, okay? But it's still a very healthy level. Okay? Bear in mind, it's something that we lose that water in the disc as we do age. We also can speed up that process with the scoliosis, okay? Because your scoliosis does not stop at this level, and therefore if there's uneven stresses on that disc, it can cause some loss of that water. Let's, before we start marching down, make sure we understand the normal anatomy on this view, because this is going to be the most helpful view. And if you have any questions, I want you to ask. Okay. One of the things that I see on your MRI, which is unrelated to your spine, is this over here. Okay? This over here. This looks like, to me, a renal cyst. Okay? Now, everyone has cysts in their liver, their kidneys. I shouldn't say everyone. Most people. And we just incidentally pick these up by getting an MRI. Doesn't mean it's cancer, doesn't mean it's anything bad, but it's something that I'm able to appreciate, not as a nephrologist or a urologist, and it's something that I would recommend that we bring it up to your primary care doctor and maybe just get a renal ultrasound. Okay?
I think they've done this.
I was just going to say that. I think.
And we've decided it's nothing to be concerned about.
Yeah.
Good.
Yeah.
So then,
He did.
if he's already picked it up, then it's nothing to be concerned about. We're not going to make an issue of something there's nothing to be concerned about. So now we're at L1, L2, okay, and we can go back.